Does having good shoulder range of motion really matter going into your CT scan and radiation? Yes and yes. For the CT scan, you want to ensure that you can get into the required position to avoid delays in radiation. And for radiation, you not only want to be able to get into that position, you want to be able to comfortably sustain it day after day for the duration of your radiation schedule. This video details 5 movements that will improve your shoulder range of motion leading up to your CT scan and radiation. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. What's the timeline on when you'll need to reach this range of motion after surgery? A CT scan is done for planning purposes before radiation. The timeline can vary quite a bit, but my CT scan was about 9 weeks after my double mastectomy, and then about 2 weeks later, I started radiation. The goal after surgery is to have most of your range of motion regained in about the first 6 weeks after surgery. If you're most of the way there, it will be easier to achieve the positions required for the CT scan and radiation. What's the position required for a CT scan? You're going to be lying on your back, and then your arms are going to be up overhead. Your arms are slightly raised off of the table because they're sitting in these holders, and that actually makes it easier because you're not all the way back on the table. Your arms are also going to be slightly bent in that position, so that does make it easier with your arms overhead being in that position rather than completely straight, as the range of motion would cause a little more tension doing it that way. When I had my CT scan appointment, I asked the radiation therapist what would happen if a patient weren't able to get their arms back into that position. She said that the appointment is canceled and then patients are given exercises to improve their shoulder range of motion. The CT scan is then rebooked for 1 to 2 weeks later, or when sufficient range of motion is reached. Delaying the treatment schedule is the last thing you want to be hearing when you're going through breast cancer treatment. At this point after surgery, I hadn't had my shoulder range of motion checked by anyone, and the focus, I think, is much more on obviously treating the cancer and then also figuring out how you're healing from surgery and then what treatments are going to be next. I think that if I had voiced concerns that my arms weren't moving well after surgery, this would be addressed at that point. What could be limiting you from raising your arms higher? It could be from the surgery itself. Lymph nodes being removed, and then cording is sometimes a result of that. It could be from your muscles guarding in the area and just tightening and not sort of allowing that range of motion. Or it could be from purposely limiting your range of motion for the first few weeks after surgery. How about the position for radiation? The position is actually quite similar to that of the CT scan. The only difference is that when you're doing a CT scan, you're only getting into that position once to hold it. For radiation, you need to be able to repeatedly get into that position for 10 to 15 minutes, 5 days a week for several weeks, depending on your radiation schedule. You really want to be able to sort of relax into that position and not be holding tension for the duration of your radiation session. If you're not able to relax into that position, it can aggravate your shoulder, and that shoulder probably has issues already if you had a hard time getting into the position in the first place. It can also result in some compensations in some of the surrounding muscles. So if my arm was up overhead and I'm holding tension doing that, it's usually my neck that will get aggravated or the mid-back. These 5 movements will target the areas needed to improve your shoulder range of motion. The first movement is arm lifts. You can clasp your hands in front of you and slowly lift your arms upward until you feel a stretch. You can hold for about 5 seconds and then return to the start position. For this exercise and the following exercises, you'll need to push your range of motion much more than you did for those initial stages after surgery. You're out of the time frame where there's concerns about pulling on any incisions, so go at it. As a comparison, this is what this exercise would look like at the initial stages after surgery. And then at this stage, you can see that I'm lifting my arms up much higher and pushing that range of motion. The second movement is an elbow pushback. You can place your hands on the back of your head. Your fingers don't need to be interlocked. Move your elbows back by squeezing the muscles in between your shoulder blades and hold about 5 seconds. You'll feel a stretch in your chest doing this movement. If you have cording, you may actually feel the stretch down the inside of the arm as well. Again, as a comparison, this is what this exercise would look like at the initial stages after surgery. There's much less range of motion with pushing those elbows back. At this stage, you can see that my elbows are pushing back much further with each repetition. The third movement is a wall walk to the front. Place your hands at about hip level and slowly walk your hand up the wall until you feel a stretch. You can hold 10 seconds or 3 deep breaths at the top. Lower your arm down and then repeat. Just like the previous exercises, you can push your range of motion much more at this stage. When your hand reaches its highest point, you can think about pushing your body weight in towards the wall like you're trying to touch your underarm to the wall. You'll feel this stretch in the underarm area, maybe at the side of the chest or into the arm, just depends on where you're the tightest. The fourth movement is a side lying pec stretch. You can start lying on your unaffected side and then place your affected arm straight out in front of you. Keeping your arm straight, move your arm back as far as you can and hold this about a minute. This stretch helps to open up the whole chest area. Slow, deep breathing throughout the stretch will make this more effective as it will help the tissues to let go more. The fifth is hands-on treatment. This obviously isn't an exercise, but it will be really effective in improving your shoulder range of motion if you pair it with the previous exercises. Treatment will also help to reduce compensation tension in the surrounding areas like your neck, mid-back, shoulder, and chest, and this will help to reduce pain. What type of treatment would be best? Any myofascial type treatment that focuses on releasing the soft tissues. This could be from a chiropractor, a physiotherapist, or a massage therapist. If this video was really helpful to you, it would be great if you subscribe to let me know. If you're experiencing a lot of tension after your mastectomy or lumpectomy in your chest, in your underarm, or the back of the shoulder, you're not alone. Many women experience this, and I definitely did. This next series covers the best stretches to address tension in these areas.